This video will illustrate a step-by-step process about how to administer your medication through your IV catheter through an IV bag known as gravity drip, because it drips through your IV line through the force of gravity. Please note that the products that are seen in this video may differ slightly in terms of color or size than what you receive at home. Your clinician or home health agency nurse will demonstrate all of your supplies during your first few visits. If you ever have any questions regarding this video or your supplies, contact your pharmacy. The number is located in your patient packet that you received with your first delivery. Before you begin, if your medication is refrigerated, remember to take the IV bag out at least an hour before your medication is due. It is a good practice to set a reminder for you to do this step about an hour before your scheduled dose. Place your IV bag of solution on the sash mat that you should have received in your first delivery box, or you can put your IV bag on a hard surface that you have thoroughly cleaned. Step 1. Washing your hands. To start with, you will need to wash your hands thoroughly for at least 20 seconds using soap and water or a disinfecting alcohol-based hand sanitizer if you don't have access to soap and water. When finished washing your hands, you will dry them with either a paper towel or a clean hand towel that is used only for this one time. Use the towel to turn off the faucet. Step 2. Your medication. You've already removed your IV bag from the refrigerator and should have placed it on your clean sash mat or a clean surface. Do not put this bag in the microwave nor run warm water over it to hurry up the process. Review the label on your medication bag. Make sure it has your name, the correct name of the drug, and the dose. Look at the expiration date. The medication should be clear and consistent in color and free of any visible particles. If any of these are incorrect or cause you concern, do not infuse and notify your pharmacy. Step 3. Your supplies. Now gather your other supplies, which include 2 pre-filled saline syringes, a heparin syringe if this has been ordered, IV tubing, a red protective end cap for the IV tubing, which you're going to use only if you have to administer your medication more than once a day, antiseptic pads, and an IV pole. Take the wrappers off the syringes. After you have gathered all the supplies needed, it's now time to sanitize your hands, as you were instructed earlier. Step 4. Preparing your syringes. Now you will prepare the syringes. Each pre-filled saline and heparin, if you're using it, syringe has a cap on the end. To make it easier for you, the saline syringes have a white cap on the end, and the heparin syringes have either a blue or a yellow cap. They are also clearly labeled on the side of the syringe. Hold each syringe upright. Loosen the cap on the syringe, do not remove this cap, and gently pull back the plunger of the syringe to pull in a small amount of air. And then push the plunger of the syringe until a small amount of solution comes out from the top. Now you can retighten the cap. This removes any air that might be in the syringe. Tighten the cap and then repeat this with all the saline and heparin syringes and place them back on the sash mat or clean surface. Step 5. Preparing your IV bag. You are now ready to prepare your IV bag and tubing. Remove the IV tubing from the package. Untwist it to its full length, keeping both ends of the tubing in your hands or over the clean surface. There is a clamp on this tubing. Pinch this clamp to close it. Then place this tubing on the mat or clean surface. Hang the bag of medication on the IV pole. Remove the tab from the port on your IV bag, being careful to not touch the exposed port with your fingers. Next, pull off the protective cover from the spiked end of the IV tubing and put the spike into the port of the bag using a pushing and twisting motion. You are now ready to fill the IV tubing with the medication. This is called priming the line. Turn the flow control device on the tubing to the open position. Now locate the drip chamber at the top of the IV tubing. Squeeze and release it, allowing medication solution to fill the chamber about halfway. Open the pinch clamp on the IV tubing and watch as the fluid moves down the tubing. When the medication drips at the end of the IV tubing, close the pinch clamp and then move the flow control device to the off position. Your tubing is now primed and ready to use. Do not remove the protective cap at the end of the IV tubing yet. There will be a rate written on the label of the medication. Set the flow regulator to that rate by twisting the flow control device to match that rate. Step 6, flushing the catheter. You are now ready to flush your catheter. SASH means saline, administration of medication, saline, and heparin. And we believe it is easy to remember the steps by using these letters. If there is a swab cap on the end of your injection cap, remove it now and throw it away. Then open an antiseptic pad and clean the end of your injection cap vigorously for at least 15 seconds. Do not ever remove the injection cap. If for some reason the cap is removed or comes off, be sure to clamp your catheter and call your pharmacy right away. Now, remove the cap from the end of the first saline syringe and attach it to your injection cap by pushing and twisting until it is firmly in place. The end of this syringe is sterile, so if you accidentally touch it with your hands or put it on a surface, then it needs to be thrown away, and you will need to get a new syringe. Keeping the syringe end sterile is very important to help keep you from getting an infection from your IV catheter. Unclamp your IV catheter. Push the plunger on the saline syringe slowly, or you can use the pulse method to flush the catheter. To use the pulse method, push the plunger, pause, and push and pause again until the syringe is empty. Do not force the flush if you have resistance, and contact your pharmacy if you are unable to flush. After you complete this step, remove the syringe from the injection cap and throw it away as instructed by your nurse. Step 7, administer your medication. You are now ready to administer your medication by attaching your primed IV tubing to your IV injection cap. Open another antiseptic pad and again clean the injection cap vigorously for at least 15 seconds. Do not let the injection cap touch anything after this cleaning. Remove the protective cap from the end of the IV tubing, again being careful to not touch this sterile end. Twist the end of the tubing onto your injection cap in a clockwise motion. Do not over-tighten. Be sure that the flow control device is set to the rate that is written on the label on the bag. Then open the pinch clamp. You will see that medication is now dripping into the drip chamber. It is important to observe the time that you start this process. You may set a timer to assist you with keeping time. Closely observe the IV bag to make sure that it finishes on time. Your medication should finish in the time that is written on the IV bag label. It is important for you to be sitting or lying down so that gravity will allow the medication to flow unrestricted and at the correct speed. Watch the drip chamber close to the end of the set time so that you can close the pinch clamp when the bag is empty. It is best to still have some fluid left in the drip chamber. When the medication is completed, use hand sanitizer on your hands. Close the pinch clamp on the IV tubing. Then turn the flow control device to the off position. Disconnect the IV tubing from your IV catheter, taking care again to not remove your injection cap. You will leave the empty bag with the tubing attached until your next scheduled infusion. If you're only receiving this medication one time a day, you will now discard the tubing and the bag. If you do have more than one dose in a day, you will place a new red cap to cover the end of the IV tubing so that you can use it again. You can use the same tubing multiple times for up to 24 hours. Leave the tubing attached to the empty IV bag until your next dose is due. At that time, you will follow all the steps you've already completed, but will first remove the tubing from the used bag and spike a new bag with the same tubing. Step 8. Flush the catheter again with saline and heparin. You're now ready to flush your catheter with the next saline syringe, being sure to clean the injection cap with an antiseptic wipe for 15 seconds. Discard the syringe when the syringe is empty. If you have been instructed to do so, you are now going to repeat the flush with the heparin syringe. Again, cleaning the injection cap with an antiseptic wipe for 15 seconds. The heparin syringe has 5 cc's of solution. The label on this syringe will tell you how many cc's to flush. If you used the pulse method when flushing with saline, we recommend that you do not use this method with the heparin and just slowly push the prescribed amount into your IV catheter. Clamp your IV catheter before removing this heparin syringe, and then throw this syringe away. You can now put on a new swab cap at the end of your injection cap. Now is a good time to rewash your hands. Congratulations! You are now finished with your IV medication by gravity bag. If you have more than 1 lumen on your catheter, there are more steps to take to be sure that you keep all lumens open and ready for use. To learn more about that process, please look at the video that is titled Catheter Care. Your pharmacy is available to help any time of the day, any day of the week. Do not hesitate to call us with questions or concerns. This contact information is in your folder. You will also find resources on our website available to you at www.ameritaiv.com. We look forward to the opportunity to serve you.